FM. This is where good music lives. My name is Mariam Bishar.
Most bankable host Brian Aseli. And of course, we know September is Suicide Prevention Month. But as that happens, are you checking up on your friends? And when you do, what's really going down in their lives? Because the sad incident on page 3 of the Daily Nation really captured my attention, where intern doctor in Gatundu dies by suicide after 36-hour shift.
That's right, of course, and it is also worrying to see sometimes what bad governance and bad systems can do. Now, Dr. Desree Moraa, who was a medical intern at Gatundu Level 5 Hospital in Kiambu County, returned home on Sunday evening after a 36-hour shift. She went to the rooftop where she was later found dead by the caretaker, and she was 27, being hosted by a colleague who had rented a one-bedroom apartment near the hospital. Now, when the nation spoke to other doctors, interns as well, and people who had worked with her, they said several things. One, that you're embarrassed as an intern, you're embarrassed before patients by supervisors, made to feel like you are nothing, which lowers one's self-esteem, which can be publicly humiliated or, sometimes left with a patient to take care of on your own. In the case of Dr. Moraa, she had been working a back-to-back 36-hour shifts with no nurses to assist because they are on strike over lack of pay. And of course, she had also said that she had gotten into an altercation with her supervisor.
As you look at that, it's an incident where there is much to be read in between the lines, simply because this is a person who came off work and just needed some time alone. And on wanting some time alone, the person she was living with, the person hosting her in that one-bedroom house, would just give her space to go and exhale. And of course, we're looking at a situation whereby this is a young person who's really done everything that the book says. Go to school, study hard, become a doctor, change your life. But then as we are trying to change our lives, you're looking at an incident where medical interns who are not actually seen as doctors. I don't know why it looks like that, at least according to the eyes of the government, who are fully covered in the return to work formula signed with the health ministry after a good number of days of striking, that is 56 days. But we are not seeing the kind of respect also accorded to them. And also, if this story is anything to go by, we are seeing long hours shift without assistance. She had to perform surgery without assistance. And when you go home, unaangalia paycheck kidogo ni kama hakuna kitu. You're also equally not covered medically. Hata ukitaka any form of help, then who's going to assist you?
That's right. And the KMPDU Kiambu chairman, Maina Githinji, said that we have always been talking about, things like this, and we need to employ more doctors, pay them well. Kiambu County, for example, has 3 million people, but only has 300 doctors, which puts a heavy load on the interns. So we are aware of the suffering that interns have been enduring. We're also aware that one of our members is accused of abusing them. Harassment of interns in our trade has been a thing, and it must stop.
And of course, harassment is something that has been seen in different sectors, but I didn't know that it was happening, especially in the medical sector. I thought that there was utmost respect for colleagues who you're helping with. I think diseases and illnesses and body conditions should be the reason as to why you team up and fight against each other, or even intimidating your colleagues. In as much as someone is they are professionally trained, so they're equally like you on your few days before you became the professional that you claim to be. So we say pole to the family of Dr. Moraa, and we also say pole to the friends who have lost a dear one, and also to the Gen Z, because this is a Gen Z doctor. We say pole to anyone who's been affected directly or indirectly.